Um, my name is Adesitu Afolabi. I'm still your host. I'm the MD CEO Wellness. I call myself the boss lady of Wellness Healthcare Group because that is what everybody calls me. And I'm a pharmacist by profession. I'm a wellness coach. And I love to do this because this is the way wellness has been able to, bring information, the right ones to people so that the reason why we are existing, which is to promote the general well-being of the people, is achieved. We're actually passionate about improving the general well-being of the people. And this we do consistently with seamless access to quality care through our HMO platform and also through our community pharmacy retail outlets all over Lagos. This we do by providing quality pharmaceutical care and services to those people. I want to say welcome to our timeline. Welcome. It's a very good morning to be alive. We want to say thank you for logging in. Thank you for being on our timeline. You make this happen. Last month, we actually discussed about menstruation and the girl child, and I learned a lot. I was able to learn so many things, reasons why you should not be afraid when people are complaining about rashes, why you should tell them to keep trying a new one. It could be sensitivity, the right hygiene that children should actually know. And even though I've been going through that process for the last 32 years, I learned a lot of things that I didn't know at that time. And while we're telling people about menstruation, some group of women approached us and said, why not tell us how to prepare for menopause? And for me, that have life examples of what people had gone through menopause, it was easier for me to connect with that. So today we're going to be talking about preparing for menopause. If you're on this timeline, please don't be the only one that will listen to this. I want you to send the link to friends and family, especially people in their 40s, so that they can also be a part of this. It's very important, and every one of us is a part of it, a part of this. And there is a chat box in your on the YouTube page that you have. You can ask your questions. When you ask your questions, we will be ready. We'll be able to, answer some of those questions aside the ones that you have sent in before now. I want to say thank you to Mr. Joshua again. Mr. Joshua, you're welcome. He's our interpreter. He helps us to connect with a special group of people on our timeline, and we appreciate you for what you do monthly. Today, I'm not going to be here alone. I'm going to be talking. I'm going to be hosting this with a gynecologist. She's very passionate about women's health. She's Dr. Modupe Adedeji. She's a consultant gynecologist at LASUT, and she's also the MD of J.A. Lashma Hospital. She's passionate about women's health. She's passionate about women's education. She's an advocate for women, enjoying life with quality, let me say, with general well-being. They should be well so that they could enjoy life. That's what she does ordinarily, and that's why we've reached out to her to be a part of this. So welcome, Dr. Adedeji. I want to say that for those of you that are not part of a community, please join our Telegram page. The link will be shared on the platform, both the Facebook Live and the YouTube Live. Please join our Telegram page so that you can be a part of community that gets firsthand information about their health. And also, don't forget to follow Wellness_Care on our Instagram and Facebook page. We want to be the first set of people to know what we're doing and why we're doing what we're doing, and get well. So thank you very much for being a part of this. So, Dr. Adedeji, are you ready?
Yes, I am.
Yes. So we want to talk about menopause today. And sometimes when you're feeling somehow, somebody is telling you that, are you sure it's not menopause? So what is this menopause? Can you tell us what menopause is?
Yes, thank you for having me on here. I'm happy to be called on, and actually a very important topic to discuss, because mostly in this part of the world, we just find ourselves in some situation, and it's until when we get there before we start seeking for help, or we don't even seek for help until when we are now having some complications before we see our parents in our hospital facilities. So this is actually a germane topic. So menopause is, as it's called, is actually like got coined from a Greek word, meno and pause. So meno means month and pause actually means stop. So menopause means last month of not seeing your menses. It's actually a retrospective diagnosis in that you could not see your menses this month, and you may think that, oh, well, one will first of all want to think of pregnancy commonly, but depending on the age, you deny that I can't be pregnant, then you may want to wait. You wait the next month, and then it doesn't come. But if you have a stretch long of 12 months without having any menses at all, then that is actually that you have menopause. So that's why I said it's retrospective. So until you clock a year of not seeing your menses, they will now regard it as menopause.
Oh, so until 12 months straight of not seeing menses, then you can see menopause. So that means it could be pregnancy if it's just 3 months.
Yes, it could be, yes.
Okay. Okay, so what are the different stages? Why should women pay attention to one of those stages called menopause process? What are the different stages involved in menopause?
Okay. So you've asked me two questions. What are the various stages? And the second one is, why should women pay attention to it? Yes. Is actually, let me start with the fact that it's actually supposed to be physiological, but we should not rule out the fact that it can suddenly happen as a result of some condition. So let me talk about that suddenly happening, because that one is very short, in that it can be imposed for certain reasons. For instance, a woman who ruptured uterus at delivery, and we as obstetricians, we have to ensure that even though the baby is dead, definitely in utero, that's inside in the womb, she's still bleeding. So the fastest thing that can be done to keep her alive is to remove the womb. And alongside, at times, we may have to remove the ovary. Definitely, when the ovaries have been removed, that means there's no menses anymore. So that is already the next month, she would definitely not see her menses. So it can also happen to women who are on the diagnosed of some cancers, any type of cancer, and you are placed on chemotherapy. So it affects the ovaries. So that means that eggs will not be available. Yes, eggs will not be available, and then that is menopause. Then it can happen if they're also undergoing radiotherapy, which is one of the modalities of treating cancer as well. That is also menopause. So invariably, menopause, as I said it's a Greek word, but anatomically, it just means that follicles are finished. Follicles means eggs are finished. And when these eggs, we are born with them, unlike men that continue to manufacture sperm. But for female, we are born with the amount of eggs that we need for our reproductive life. So as soon as we are born with it, we tend to get rid of about 400 to 500 eggs every month. We are born with about 300 to 500,000 eggs when we are born, especially when we attain puberty. It was counted sort of scientifically, and that averagely every woman has 300,000 to 400,000 eggs as soon as they are born. So you now start getting rid of about 400 to 500 every month. That means that only one of the 400, 500 is expected to get fertilized and be a baby. So as soon as you exhaust all the eggs, that is menopause, so to say. So it's actually in stages, because you can see, as I said, the eggs will continue to deplete gradually until it eventually finishes. Exactly when one is above the age of 40, 45, thereabouts, you have less than 1,000 eggs left. So invariably, they can never be optimal. So at the end of the day, you first of all experience irregular menstruation, meaning that, as I said, you said 3 months, I said 12. That 3 months could actually be the preparation. So we have what we call perimenopausal period, we have the menopause itself, and we have postmenopausal period. We call it like like a ladder, climbing a ladder of the reproductive life that is in stages. So perimenopausal period is actually the end part of the reproductive life. That means that is when you start having these irregular eggs coming out. And if they don't come out regularly, then you will not see your menses for 2 months, 3 months, counting 6 months. Then it comes again. Oh, maybe what happened? At that period, it should have been, if one is very inquisitive, you are supposed to come and see your gynecologist, even if you don't have any symptoms, that what's happening. Then you can actually now count exactly 12 months. Then you can now say, oh, this is menopause. Then some years after that, maybe some people 2 years, some people 5, 10 years, they are still experiencing the problems of what menopause can bring. So eventually after that, then maybe I should say you can get used to the condition, in that you are now realizing it's aging, it's an aging process. Then you get used to it, and those symptoms may now be a lifestyle, they are used to it, or they just get better. So it's like a climacteric period. That's a ladder of the reproductive life and all that. So the reproductive age is actually very important. Our reproductive age is actually between the age of 15 and 49. But we start preparing for menopause from the age of 45 to 55. So that is a perimenopausal period. The period, some people tend to start earlier, 40 to 45. That one we call it early menopause. And can you imagine, some people even start below that age. I've seen women that started menopause at 30, 35. So it can be pathetic if the person has not started his or her family, you understand? So we call that actually premature ovarian failure.
Wow.
Yes. So let's remember that when there are no more eggs, there is no more menses. That is menopause.
Thank you.
Now, I've forgotten the second question.
Why should a woman prepare for the perimenopausal process?
So I like your expressions, Imagine if you don't have this knowledge. You cannot imagine if you are hearing me and you are saying wow already. Then if it's not happening to you, you cannot imagine. So knowledge is power. You should know what is going on in your body. And it's very important to know what is going on in your body and to know how to prepare. For instance, people come to see the gynecologist and we ask funny questions like, when are you getting married? Depending on the pathology, the problem you come with. You'll be like, my God, my parents are on my case at home to go and get married. Now I'm coming to see the doctor. Doctor is already telling me again that when am I getting married? Because there are stages in a girl child life or in a female, so to say, encompassing. There's a period of maturation where your breast, all that has to grow to enable the attraction for the opposite sex. And there's also the period where you are supposed to be married and start producing children. And definitely there's a period where you have finished producing these children and then you have to enjoy old age. So it's in stages. So you have to make optimal, you have to make that period of your life, each point of it very optimal. So it's important to prepare for it because it actually comes with some bizarre symptoms that you can even explain in this part of the world, like it is like malaria, because everything in this part of the world is malaria. Thank God for the introduction of COVID-19. So maybe we will start thinking of COVID soon.
So what are the symptoms? What are the common symptoms of the perimenopausal stage? And when should a woman cry wolf? When should a woman cry wolf? I've seen people having to take antidepressants and all that. I've seen people almost lose their homes, and I've seen people. I've seen children complain about their moms that she has become so erratic and nobody seems to understand what is going on. Of course, it takes a lot of energy to, you're seeking counsel from a psychologist and not even knowing that a gynecologist is needed to be seen. So what are these symptoms and when should a woman cry wolf?
Yes. Well, in the past, what usually happens is that we just get used to the symptoms because our mothers, our parents, figures, and aunts just say it is a normal thing. That's even if you ask, it's a normal thing. But we have come to realize that every inconvenience, there's actually some explanation and some management for it. So initially, we have some initial symptoms that we call vasomotor symptoms. That means what you feel, your vessels and all that, because it's actually basically, women are a bundle of hormones. So I've talked about the eggs finishing, and when the eggs are supposed to produce particular hormones, progesterone and estrogen, exactly, most of the time estrogen. So the estrogen has a lot of work that it does in a female's life. For instance, it's what gives us all our curvature, what determines our breast size and that is growing. And even this voice, a feminine voice and all that. So it does all those. So imagine that even involved in bone strength. So imagine when that very important chemical, so to say, hormone, is withdrawn. So you can imagine the things that will form around it. The very common one is this feeling of, aside from the menses that becomes irregular, I've talked about that severally, is now this feeling of what we call hot flushes. Some call it hot flashes, but commonly I'm sure we know hot flushes. And it's like you first of all feel some heat just coming from the center of the head, right down to the belly button. And the next thing you feel is that from that very point, you just sweat out, and you just notice that you are always sweating. You are always sweating. Sometimes it's even common in the night. You say I sweat. Most times, even in the night, I'm sweating. So I said three symptoms: hot flushes, sweating, and then night sweat. I've separated those two, you know. Then another thing that you can notice actually too is that your sleep is disturbed. Maybe you are somebody that sleeps comfortably before, you sleep and really enjoy your sleep. So you just know your sleep has been interrupted somehow. You can't sleep. Immediately you sleep some 2-3 hours, you are awake again, you are trying to catch sleep again, and all of that. So those are the very early symptoms that the woman can have. And it starts around the perimenopausal period. So alongside that, you are noticing that the menses is becoming regular. So that means you can take a quick guess that most likely, and then your age, the age, 45, 40, 46, 50, 51. Oh, okay, so that means to me, you know. So knowing that actually will also help with the symptoms, you know, and all that. So then those are the primary symptoms that you can have. Then by the time you go ahead, when the menses now stop completely, you know, you counted 12 months, you are now menopause. Then other things can be setting in, like you just notice there's a dryness, vaginal dryness. You also notice that you're always like urinating frequently, because oxygen helps to deal with the muscle of the pelvis, making it strong. So at this time, you can't keep urine for so long. You just notice that, and you check your blood sugar severally, and there is so fine. So another thing to emphasize is that some of these symptoms could actually be symptoms for other things. So that is why it is very important to emphasize coming to see the doctor, so that we can place what is what. So that you not just sit at home and say it's menopause. Meanwhile, there are other things that are happening. So the symptoms are kind of overlapping other pathologies, other diseases, so to say. So vaginal dryness, frequency urinating, I've talked about inability to sleep well. Then bone pains, you notice that small bones in the body are just kind of painful. Back pain, your hands at times are kind of painful, you know, just some funny things like that. And then in older age, obviously, when it's obvious that yes, you need to take things easy, there can be some little fractures that can easily occur, like hip fracture, smaller fractures. Then at times the big bones can also be involved, that you just fall down, like, and what kind of fall? Was just a small fall, and they are telling you that you have a fracture, which in the younger age may ordinarily not be like that. So those are some of the things, and many more that you can present with. So the emphasis is that these symptoms you must actually seek a professional opinion, because as I said, urinating a lot may actually be that diabetes is setting in, because 45, that is actually the age, 40, 45, that's the age of medical condition, especially if it's in the family, diabetes, hypertension, and all that. So you have to rule some of those things out. Then you can see that I like your expressions. These symptoms can actually be not funny. It may not even be that it is the menopause that is causing depression, but the mere symptoms that you are feeling that you are not like you are used to before, you know, can be causing depression.
Can be overwhelming. It can be overwhelming.
Yes, and then that's why depression was also listed as one of the symptoms. But ordinarily, the patient may actually have a depressive illness, which may not just have been from menopause. So you can see it's quite important to come forward and let us put symptoms as where they are.
Thank you, Dr. Adedeji. Thank you. I like the fact that I'll give you an instance. My mom, when my mom was in her 70s, when she clocked around 70, that was when she started noticing that she was having frequent urination and all that, and she didn't tell anyone. she just assumed in herself that it was a old age. And
Okay.
one of those days I went to see her, and I was like, I don't like it. This, of course, she has started shrinking and all that. Old age make people shrink as well. So you like, okay, she's losing some fat and all that. And I took her to the hospital. Her fasting blood sugar was 482. I screamed. I said, so all the symptoms, why didn't you tell anyone? And she said it was old age. And from that moment, I just realized that for just like you said, for every woman that is going through some of the symptoms that you've said, shouldn't just say that, shouldn't just say it's menopause, because it could actually be some other pathological cases, some other disease cases that needs to be taken care of. So we need to rule it out. We need to rule menopause out from other illnesses, and especially when someone is not sleeping, could be other things. And of course, now you've told us about hot flushes and all the sweating and eye sweat. We could also know that this is, but it could actually even be some other things. It could be thyroid and all those things. So thank you for talking about it. So now we know that menopause is in 3 stages. We have the perimenopause, we have the menopause, and then postmenopause. The perimenopause is when we should all be aware of all the symptoms, so that number one, we don't just say that we're going through menopause. Number two, we seek help adequately. So when you see women saying that they have something crawling around their body, and they're having their palms heat on their palms and on their feet, is it still part of perimenopause symptoms?
You can see the difference now. It wants to sound like hot flushes, but I describe how hot flushes is really. You feel the heat right from the navel up to the head, and then the next thing you just sweat out. And you see the level is starting from the navel, belly button, up to the head. You just feel this heat. The heat is not, it's like, these are firewood that you feel like when when they're using firewood, the days of jollof rice party and all that.
Yes.
Just move a bit close to the fire. You feel the heat around,
Yes.
just like that, in patches. So just
Yes.
exactly similar to that. And then it goes all around your head, and then the next thing, you are sweating. So it's different from crawling sensation or heat in my palm and leg. Do you understand? As soon as you said crawling, what came to my head is some of the symptoms of
Anxiolytic symptoms. Yes.
Yes, and aside from that, the psychiatrist can even say it's somatic.
Yes, somatic symptoms.
Yeah, you can see that. So you really have to clarify those symptoms as well. So those are the things. When you come to clinic, we ask for your name, you ask for your age, you are like, well, come, please, why are you asking me questions? So those things are very important in order to place things together in the age. For instance, I'm saying that in 30-year-old woman. She's telling me she's not seeing her menses. The last time she saw her menses was like over a year ago, and she's having heat. She feels heat. She's always not interested in things, mood swings, and all that. I will not want to think of menopause first because she's 30. I will want to think for something else just because of her age. But by virtue of asking for some investigations, and I'll just see the results, and then I'll just be shocked. In fact, I will still want to be clear. I'll have to ask for further investigation, because I don't expect that at 30 you should be at menopause. Yes. But truth be told, you have those kind of things happen.
Okay. Thank you, Dr. Adedeji. If you have questions, please don't forget to go to the chat box and ask your questions. We'll love to take in more questions. Thank you, Dr. Adedeji. So now that we know how a woman can be sure if the symptoms are perimenopause symptoms and all that, and you've also told us that menopause can actually start earlier, from age 30 to 35, depending on the person's, depending on any other illnesses that might that person might actually have. So we know that for age 40, 41, most times 40, from age 40, people should actually prepare for menopause between 45 to 55. And I'm also preparing. That's why this topic is very important to me.
Yes, exactly.
I'm also preparing.
I must also add that any blood after that age, any blood from the vagina after that age of 55, because that's the upper limit, must be investigated.
Wow.
Yes, you shouldn't assume that I'm still on my menses. Yeah, I hear some people say, it's day 16, she menstruates, I menstruate up to that, is actually something else is happening. Because by that age of 55, we don't expect any woman to be seeing blood anymore.
Okay, so at age 55, any woman that sees menstrual blood,
55 and above,
should seek medical advice immediately.
Immediately, yes.
Wow, thank you. I think we've had that. Thank you. So nobody should say that I'm going to I could have baby forever. That's serious. Okay, so you've described hot flashes. Also, so what you're saying now is that you made a statement that the depression sometimes is not a symptom, but it actually could be the response to some of those hot flashes and mood swings people are going through. Yes. So what can we do? What can we do? You see this hot flashes is even scary. You're already talking about the kind of fire that comes from Adogon, and I'm picturing those Christmas meets, Christmas parties we do, and if it at beside the Adogon, when they tell you to just go and drop the Maggi beside it, and you're saying that's the kind of heat that will just that you just come in contact with, and so what can we do? What can we do to relieve ourselves of these symptoms? What can we do?
So number one, we should first of all understand the fact that it is physiological. So let me use the normal English, because physiological may sound too medical. It is a normal process in life. Just like we should understand that aging, we cannot stop growing. We can't stop it. And there's no drug as at now that is anti-aging.
There are creams, though. There are creams that does aging.
They don't call it that, but the point is that the system is aging. Each of the organs in the body is aging. So there is no drug as at now. So it's an aging process. So you come in, some people, just like menstruation, some people have menstrual pains, that's dysmenorrhea, and they cope with it because it's quite mild. They know that when it's the menses, there's just some slight pain and fine. But some people have to be admitted in the hospital just because of menstrual pain. In fact, a lot of friends will think that maybe she's had an abortion or something, exactly with how women can cope with menopause as well. So some people can actually cope, and but not to be dying in silence. So because I said you can cope, but we actually pay attention to those people who have this huge complaint and they keep coming to clinic. In fact, if the doctor is not suspicious enough, may actually be treating other things. Meanwhile, it is just that menopause that's the problem. So eventually, the coming in of the gynecologist may put a clarity to things. So in those kind of people, we may want to introduce hormone replacement therapy.
Okay.
Yes.
So what does that do?
Yes. I told you that the eggs, that's the follicle, they are also responsible for producing a good amount of estrogen.
Yes.
And alongside help with progesterone, which helps us in all our reproductive activities and whatnot and all that, and every other systemic effect that they have. So since the eggs are absent, so what we now do is to give this estrogen exogenously. That means that we are giving it either by tablets, either by injection, either by transdermally, that means under the skin, or by an implant and all that. We are just replacing it. We are replacing it. Yes. These are usually given to selected few. People, women, that's why we say it's given at demand. Meaning that if the symptoms are becoming, you first of all start with psychological therapy. That means you let the woman be aware that, madam, this is menopause. So you're around it and all that. Then she comes around so frequently, and maybe the symptoms are getting worse. Then you want to introduce it. And the reason for this is that there's no drug that does not have a side effect. And this is because of this huge side effects that hormone replacement therapy can have.
Wow.
Yes.
Wow. So there's hormone replacement therapy to replace the estrogen that is wearing off in the system of the woman.
That has worn off, in fact.
That's one off, not even wearing off.
Coming from the eggs. Yes.
Oh, so
even those other parts of the body, some other parts of the body can also produce some amount of estrogen, but it is
Okay.
so minimal. There's the adrenal gland, that's a gland that is sitting on top of the kidney. It also produces some form of estrogen, but it cannot be, you cannot, it's not a quantum that the eggs do produces it. So that's the basic thing.
Are there food? Are there food, vegetables and all those things that could help produce estrogen?
Yes, yes. We have some substances that we call phytoestrogen. Phytoestrogens that we can find estrogens in some seed oils. You can find it in some vegetables and all that. Yes. So that can actually be an option first before even going to the hormone replacement therapy. Yes.
Okay. Okay. So we can actually look for vegetables, fruits, and
Yes.
all kind of oils that has estrogen to help
Yes.
to help an average woman boost the level of estrogen they have in their system.
Yeah, so we call that some form of alternative treatment that we can give for menopause.
Okay, what other lifestyle choices that could help a woman going through perimenopausal symptoms? What should we do apart from, now we know that we can eat some food? Now we know that we can prepare our mind that this thing is happening and seek help. How about other things? Does exercise help? Does weight help?
Exactly.
And all that?
Yes, yes. So as we've talked about some inability to sleep, depression, vaginal dryness, that means that it's even going to affect the sexual life. You know, you don't get wet at all, or you don't even get wet enough. You know, so you can attend to each of these symptoms as it were. For instance, the sexual life, that there's dryness when there's going to be penetration, because sex is never supposed to stop. Sex is never supposed to stop because of that. You know,
Wow.
sex is supposed to go on throughout the
lifetime of a woman.
A woman. Yes.
We're hearing.
Because I don't understand why women will now decide that at that point that they're going to move to another room. When they're supposed to continue to remain on the same matrimonial bed with their husband.
Wow.
So what can you do that? With that, you can have to do some lubrication. You have to lubricate. And we can go as far as estrogen lubricants. We have estrogen lubricants, I think it's sold as Primarine and all that. There are some estrogen lubricants that can be used in that case. And then you are not sleeping well, then definitely we can want to give some sedatives, but that will be at the prescription of the doctor. So because you cannot start relying on that. But mostly about all this is that you increase activity, exercise, you just do things to counteract those feelings that you're having, So that's why we talk about exercises, diet, wellness, just wellness, just as you call your program, wellness.
So for every woman that wants to enjoy menopause, they should go on a wellness journey.
Yes,
the right meals,
activity,
exercise.
Yes. Avoid sedentary lifestyle, Yeah, I see what some women do right now. I was just going through my Instagram and I saw Ketenshore that she was completely bent over. I don't know, and that's because she has involved herself with a lot of lifestyle modification exercises and all that. And she's 50. She looks quite younger than that age, So these are very important things. They are very, very important.
Okay. Thank you for that fact. Dr. Dideji actually said that some of the things that a woman will experience during menopause is vaginal dryness, and she said that that's not the time for you to say that you don't have sex. Sex must continue throughout a woman's lifetime, and therefore there are things that should be done, lubricants, and she even said that is estrogen lubricant. Okay, so when estrogen, I've also seen people in their 50s and all that complaining. I know women that tells me that they can't kneel down to pray again because they are now having arthritis and osteoporosis and all that. Is this still part of this menopause thing? Because I know estrogen affects bones formation and all that. Can you shed some light on this, please?
Yes. So I was talking about the symptoms too. So I emphasize so much on the early symptoms and the intermediate symptoms. So osteoporosis, coronary artery disease, dementia, are the late symptoms of menopause. In
Wow.
fact, it's called complication of menopause.
Wow.
Some people get to that extent. Osteoporosis, coronary artery disease, and dementia, you know. So the reason for osteoporosis is just that I talked about the estrogen being contributed to the strength, to the bone strength. So when estrogen is withdrawn, then that means that the bones cannot be as strong as it's supposed to be. So, and they usually affect the inner aspect of the bone. We call it trabecular aspect of the bone. So those bones that are of smaller sizes are the ones that are most affected, because the bigger sizes like our femur, tibia, and all that, those ones are long, thick bones. So it takes a while before the aspects of menopause can affect them. But the bones that are at the back, where the vertebrae bones, where the spinal cord passes through, so that's why commonly they present with back pain and all that. Hip pains, pelvic pains. Those are some of the places where we have small bones located. Even our hands too, our hands and the toes. So are some of the things that people can complain about. Then the heart condition, coronary heart disease, and is more exaggerated in people that have been issue. They have heart condition. So these are some of the. It doesn't happen to everybody. We should take note of that. Some people have died at the age of 80, 90. In fact, the only thing you can say is that it's old age that is the cause of the death. Old age. You cannot, you can't pinpoint on something. So it's not in everybody. It's not compulsory. It happens in some set of people. Not even characteristically because of one reason or the other. The only one I talked about is the coronary disease, that it may become obvious in patients who are coming in to menopause with a heart condition, hypertensive patients and all of that. Then dementia, ability, you just notice that your memory is not as intact. In fact, that is even there when perimenopause setting is. You just notice that your memory is not as sharp, it's not as sharp. So that means that you should be involved in a lot of brain exercise, mathematics, calculation, things that keeps the brain active, So like, for instance, you said you are preparing for menopause too now. So I will encourage you to keep up with this program for as long as possible, because I can imagine a lot of mental work that you're doing to ensure that nothing goes wrong today, keeping it at. So a lot of mental work. So if you are doing that, that means you are keeping the brain at work. But unfortunately, if we have a lifestyle that you really don't do much, you don't have to, then that means that is all with menopause, depression, memory losses can be setting in as well. So you can see how they all go into one another. Yes.
Thank you, Dr. Adedeji. So being active can actually give you a better chances of managing menopausal age. Being active, being exercise, having our brain, work as much as it can. Maybe buying. I now I remember why my mom wants to buy and sell all through her lifetime, because she's always complaining she can't just sit down. She can't come and stay in my house because it's quiet. She likes her house where people are coming and coming out, and I think those things kept her longer. So
you can imagine when people, especially civil servants, that they retire, and the next thing you hear is that he died just last year. I died this year. Sorry for my vernacular. So when the activity stops, there are so many things that will set in. So many things, and it can even be an issue.
Okay, so Dr. Adedeji, when people have hot flushes or hot flashes, and somebody is asking that it gives constant headaches, what can people take? That's hot flashes when it gives when it comes to all that. What can people take to relieve them?
Yes, so hot flashes does not cause headache.
Okay.
Headache too can just be one of the symptoms of menopause. It can be just that you have. So first and foremost, that headache must be investigated first. You must find out there are over 100 causes of headache. There are over 100 causes of headache. In fact, the headache can be so mild, and it can be just a tumor that is growing in the brain. Yes. So it's important to come over and let the doctor just tell you. the headache too is menopause. So just don't assume. You use paracetamol just as how they advertise for all these paracetamol, that you use paracetamol for 3 days, you don't get better, please see your doctor. Yes. So it can be one of the uncommon symptoms of menopause, headache.
Okay, thank you. She has reiterated the fact that the hot flashes doesn't cause headache. And for anybody that has constant headaches and you feel it's menopause, I think you should see your doctor. Let them rule out everything that might be the cause of the headaches. And she has also said that headaches, there are over 100 causes of headaches. Sometimes we abuse drugs in Nigeria. Once you're having a headache, you just go and take paracetamol. Sometimes when you have a headache, it's hunger. All you need to do is eat. Sometimes it's just for you to Sometimes it's for you to just take your eyes off your devices and rest your eyes. So if you're having constant headache, yes, if you're having constant headaches and you are part of this webinar because someone asked this question, please see your doctor. Please stop taking. And the people selling paracetamol also actually advised that if you take this for 3 days and the headache does not resolve, you should see the doctor. Please see the doctor. So how can a woman handle stress? And naturally we have a normal schedule of stress, of activities, of emotional parts that we all take daily. Then this perimenopausal symptoms now also comes in. What do you advise a woman to do in this aspect? What do you advise her to do to handle all this together? Your body is asking for help, and everything around you too is asking for help. Some people are working and you still have deadlines. You have to take care of the children, you have to take care of the home and all that, and your body is actually crying for help as well.
Yes. So I understand what you're saying perfectly. So that I should also join you by saying that I'm also preparing for menopause. So I think this age 40 and thereabouts and above are actually our demanding times, because we use our 30s, maybe late 20s, to bring up the children in their cradle. And then at this age, they are already up and doing that. Then you now have time, especially for career women, you now have time for your career and you really want to achieve. And then most of the time at this age too, is that time that you may be occupying some top managerial positions, and as you have said, there are deadlines and everything. And then this menopause is also coming in. So psychologically, I think that's the management here. You first of all have to stop and realize that you are not the same person as before, and take things one thing at a time. You take things one thing at a time. Definitely for you to have been this age and you have been coming up, that means that something has to suffer for the other one. And you can speak to yourself, definitely, and all that. But even despite what you are trying to do, if these things is really getting at you, I think it's also important to come out. It's actually a condition that may need a form of multidisciplinary care. Aside from the gynecologist that you must see, even the psychiatrist may have to come in. The psychologists may have to come in. In cases of pains and all that, bone pains, we may even have to introduce the orthopedic surgeons to come in, So it is not about, most times our doors are hostile, so to say. I mean, your hospital facility doors are hostile to the citizens of Nigeria. Not that the doctors are hostile, it's just that they cause some hostility, It's supposed to be open and you come in. And I don't blame them. For instance, if we have a very good insurance system, I'm sure that would have been really nice. That you know that you can come into the hospital just for checks. And that's why I would like to also emphasize annual medical checkups, so to say, even if you can not do it 6 months. I tell people that by the time you are doing your birthday, just realize that it's your gifts yourself should be your medical checkups. So it will even help you to identify that this is menopause symptom, this one is this symptoms. If you have been doing it constantly and you're seeing changes around the menopausal period, you can attach it to menopause if it's not something outside it. And if it is not, then you can handle it appropriately how it's supposed to be handled. So it's just a period that, just like you cannot use a generator forever, you have to service it. So age 40 is the time that servicing is needed more. You need to service pay attention to the body. The body cries out at that time. So 40, 50, 60. Now our life expectancy is getting better, so to say. Maybe, so to say, because of more awareness, knowledge, and all of that. But it can still be better. They are recording people, make more people dying in developed countries at the age of 80. But we are still talking about people dying in the age of 50, in our 50s. So I think we should just take charge of our health as we are taking charge of everything in this country, education, blah, blah, blah. So we should also take charge of our health. So.
Thank you, Dr. Adedeji. So for women preparing for menopause, she actually has said that these things will happen, and your ability to manage your time, manage yourself is very important. The psychological way, and also turning to the medical personnel to help is very important. She also said that she actually said over and over again, having a wellness lifestyle, promotion of wellness, promotion of your well-being, and paying attention to the little details is very important. Someone asked a question now that okay, I think it's about people in menopause getting pregnant. Can someone in the menopausal age get pregnant, and or someone that has stopped menstruating, can the person get pregnant?
Yes. So you asked me about the stages, and I said perimenopause, menopause, and postmenopause. So perimenopause, I explained that you can be having irregular menses. Menopause, I explained, I'm just trying to reiterate for probably people that are just joining. And menopause is 12 years, complete 12 years of no menses at all. And postmenopause are the years after that. So it is possible for a woman to be pregnant in the perimenopausal period, but never in menopause and postmenopause. I'm saying normal physiological pregnancy, as in spontaneous pregnancy. But we are recording people now having babies, even triplets, at the age over 55. There was a time that it was heard on channels news that is a 60-year-old woman delivered twins,
Yes.
So all those pregnancies, if they have recorded menopause in their life, were all gotten by assisted reproductive technique. And if you want to know, those at that time, they don't even use the woman's egg. They use donor egg. So it's a donor egg, but since the uterus is still available, it is now transferred into the uterus. That's the embryo. It's transferred into the uterus, and the woman is said to be pregnant. With a lot of hormonal support throughout the pregnancy, because there are no more follicles producing eggs that will help to support, or progesterone that will form progesterone that will help to support the pregnancy. So we shouldn't be deceived.
Okay, so
what I said is no pregnancy can happen at menopause, and I've said menopause has a definition,
when the menses are stopped.
Menopause, maybe it can just happen. Like for instance, a woman at 50 was pregnant. I remember very well. In fact, she was 40 going on 50, and it was not IVF. She said she just threw caution to the wind when she noticed it wasn't on her family planning, but when she noticed that her menses was becoming irregular, in fact, she could say in her mind that it's like it's menopause. And she didn't bother anymore up until when she just noticed that her tummy was getting big and something was moving on her inside. She went for scan, and lo and behold, the baby was there.
That baby escaped from heaven.
So it has to be 12 months. Most likely, probably she didn't see her menses for like 3 months. So it was when she was supposed to see her menses at the 4th month. You have to bring out eggs. And if there is no pregnancy, that's when you menstruate. So most likely she got pregnant, not knowing, still thinking that it was her menses that didn't delayed. So her diagnosis of her pregnancy came much later.
Wow.
Can you imagine?
Wow, that baby.
And so when I was also preparing for this, I heard that the Guinness Book of Records recorded a 54-year-old woman. That's the oldest woman that got pregnant spontaneously, not by assisted reproductive technique. So you can see that it's still within that age bracket of 45.
45 to 55.
So pregnancy can never occur when the eggs are exhausted. So it's usually very pathetic for us when we have patients that were making diagnosis of premature ovarian failure. That means those people that are having menopause very early in life is usually very, very pathetic. because they just have to make do with donor eggs if they have to go ahead with pregnancy.
Okay. Someone asked a question. Can menopause cure fibroid? I know we had a presentation on fibroid. That was the first fibroid presentation, and the doctor actually said that if you're in your menopausal age and you notice fibroid, that person must run to the gynecologist to seek medical assistance. But please help us to answer this. Can menopause cure fibroid?
In fact, when I'm seeing my patient, jokingly, I usually tell them that there are two cures to fibroid. One is removing uterus completely, and another thing is menopause. So I'm not saying it categorically, because the truth is that any woman that is around the menopausal age, we will not want to think fibroid when she comes with symptoms that may suggest fibroid. We first of all want to think of other things first before we put it on fibroid, because we don't expect fibroid to be problematic at menopause. Estrogen, what is causing fibroid to go through is as a result of estrogen.
Okay.
So it's the food for fibroid. So if it is withdrawn, so definitely the fibroid starts to shrink gradually. So, but the big ones, there are some people that have big ones, and they said that they will wait for menopause and they are not doing surgery, all because out of fear, and they go around with some other problems that big fibroid can cause. I'm sure you must have talked extensively about it in your program. So everything needs you to seek a professional opinion. Look for the gynecologist so that you'll be well advised on what to do.
Thank you, Dr. Adedeji. So she's not saying menopause can cure fibroid, but she said that because the estrogen level would have been because the body is not producing estrogen, and estrogen is like a lifeline to fibroid. The fibroid could shrink. But don't wait if you have fibroid right now. Don't wait till your menopausal age before you want to do something about it, because having it in your system can actually give rise to other illnesses that you might not want to think about, and some other complications. So don't wait for fibroid to cure the menopause, but don't wait for menopause to cure the fibroid. Thank you, doctor. Thank you, doctor. Thank you, Dr. Hadedeji. You've been able to educate us about how to handle stress. You've also told us about the lifestyle choices that every woman should, in her 40s, should help, should even ensure exercises, mental agility. You've also advised that people should go for comprehensive medical check if you're 40 plus and above, and if there is anything you want to do for yourself, is for you to gift yourself a medical screening annually. Wellness can help get this done easily without so much pain. So you can contact us for us to help you to do this. She said that could help. So when you have parents that wants to do buying and selling at very old age, please allow them. It helps improve their mental agility and allow them to cope with life.
Oh, can you see me?
I can see you. I can see you.
Oh,
thank you. And she also actually told us that when we're in our 40s, sometimes it's the time that we also feel that we should begin to achieve what we want to achieve. And, you are done with taking care, doing school runs and all that. And you really want to accelerate life. And then your body is asking for help because of this menopausal symptoms, menopausal symptoms. It's also the time for you to settle down, discuss with yourself psychologically, so that you will be able to cope. No one is going to give you a straitjacket way of how to cope with stress, but you've been coping with stress over this year. So sit down and look at how you can cope so that it doesn't get so bad. And while you're going through these perimenopausal symptoms, please seek the help of medical doctors, because it might just be other things aside. It could be a thyroid thing, it could be diabetes, it could be every other thing that is overshadowing the symptoms that you're going through. So don't just sit at home and say you are growing old and this is menopause. Meanwhile, there are other things that could be affecting you. So she also told us that the main age is between 45 to 55, and some other people, due to anatomical or medical issues, could start earlier. She could start earlier, and well, there is hope for everyone. Even if someone has premature ovarian failure, like she said, the person might still have babies through donor eggs. So it's not bad. Thank you very much, Doctor. Thank you very much, Doctor Adedeji. I don't know if you want to tell the audience anything, your partner was with the audience. We've had a very good time with you. Thank you for the education, and thank you for being very practical about this.
Thank you very much. Well, I think we've tried as much because I'm happy. The way you are reiterating all I've said, summarizing, it shows that I must have been communicating. So the summary is that don't just sit down at home and cope with symptoms. There can be help that can be given when you come around to the hospital to see the psychologist. It could help you to get the period more enjoyably. I'll be more enjoying than just coping with it. So it's a normal process in life, and you should cope with it comfortably. So you can come around and let's talk to ourselves.
Thank you very much, Dr. Adedeji. She also mentioned a point that as we grow older, every inconvenience shouldn't be seen as normal. As we grow older, let us understand and know our body so that when there is an inconvenience, we seek help. It's not a time, things have changed. It's not a time to say, oh, I could cope. I know that we can cope, but we need to seek help. We need to seek help. We need to see it as an intentional thing to do, to seek help. So thank you very much. I want to say thank you for everyone that's logged in. Thank you for everyone that's watched this webinar. You are the ones that make us, go back and please ask for the topic. Some people ask for this topic for us to talk about menopause. Ask for the topic you want us to talk about so that we can also put it in our calendar and deal with in a subsequent webinar. I want to say thank you to you, Mr. Joshua. Thank you for being a part of this. Thank you, everyone. Please don't forget to follow our social media pages, wellness_care. Please don't forget to follow it. Be the first set of people to know what we're doing. Be the first set of people to enjoy some tips about your well-being. You need to enjoy some tips about your well-being. And just like you said, if there's anything any of us will do is for us to intentionally promote our well-being, make lifestyle choices that promote our wellness. She said it over and over again, and I think we should do it. We should make up our mind to do something as a gift to ourselves. This is the only gift you can give yourself, promote your well-being. So on this note, I want to say thank you to everybody. Thank you for the questions that you've asked. We hope to see you next month, the second Saturday next month. We're going to be talking about erectile dysfunction. That's the topic that we're going to be talking about. We're going to be talking about erectile dysfunction. So please, when you get the notification, follow us, subscribe to our YouTube channel as well so that you can get the notification, so that you can share with friends and family what erectile dysfunction is. Why should a man be concerned? Why should a couple be concerned? Why should you why is it a big deal? We need to know about it. Thank you very much. On this note, I want to say that God will give us the grace to see beyond today and many more months ahead of us. Thank you very much, and have a good Friday. Have a good Saturday. I'm sorry. Thank you.
Thank you very much. Thank you for
Thank you
having
for yes, thank you. Mr. Joshua, thank you for always being there, Mr. Joshua. We love you. Bye.